We're the flagship for the state of Virginia for dealing with complex health issues. Our team members are outstanding for taking care of that heart attack and helping to prevent the next one. Dr. Ellen Bogan came at a time in cardiovascular medicine when more of the plumbing side of things was being emphasized. Pipes that are supplying the heart muscle. Not a lot of people were focused on the wiring system.
Look, Ellie, perfect.
It's very complex, and Dr. Ellen Bogan was an innovator to move the field forward.
We repositioned it.
Mike and I met Dr. Ellen Bogan in 2017. Mike had a very serious and persistent arrhythmia. And the arrhythmia was really debilitating for Mike. I mean, Mike had been a 5-time marathoner, a skilled cyclist, and he couldn't do any of that. I mean, he could not walk up a flight of steps. A doctor friend said, "Why in the hell aren't you talking to Ken Ellenbogen at MCV?" Ken Ellenbogen wrote the book on arrhythmia. Ultimately, Dr. Ellenbogen gave Mike his life back.
What we also want to have an emphasis on is primary prevention. Can we prevent heart attacks? Can we prevent strokes? Can we prevent the development of heart failure? This enables our ability to address problems before they require hospitalization.
When you start to look at some of the heat maps for cardiovascular disease, cardiovascular mortality, there are health disparities based on gender, based on race, based on socioeconomic status. So it's something that we have to address on multiple levels.
There are many risk factors: high blood pressure, diabetes, smoking, inactivity. What's one of the most important risk factors? And that's high blood pressure.
So uncontrolled high blood pressure or hypertension, if we could change that, we could definitely change the trajectory of those heat maps. Tell them, you need to know your numbers. It's abnormal, it's less than 120/80. And I tell them that one of the two things they can do to help to control their blood pressure is to reduce their sodium intake and to maintain a healthy weight. And I think most people have that desire somewhere within them to know more, to understand more. It's just how do you tap into it? What do you give them so that they can take it that next step?
We've made strategic investments. One is the recruitment of Dr. Anurag Mehta, Director of Cardiovascular Disease Prevention, bringing great knowledge on how to identify who's most at risk for having a future event, but also implementing the most modern therapies. It's an individualized prescription to that patient's constellation of risk factors. Some are medications, or when to invoke a particular type of diet, a particular activity prescription that then is implemented to prevent the future cardiac event. We're most grateful to those that contribute philanthropically, and without that, we would not be able to realize the potential in addressing cardiovascular disease. If we can prevent the causes of heart failure, then patients can have an increased quality of life.